Alexander Fleming's name is forever woven into the history of humanity as the man whose quiet observation and scientific integrity led to one of the greatest medical breakthroughs of all time, the discovery of penicillin, a discovery that transformed medicine, saved hundreds of millions of lives, and reshaped the future of human health. Born on August 6, 1881, on a modest farm at Lockfield in rural Ayrshire, Scotland, Fleming grew up in an environment where self-reliance, discipline, and close contact with nature shaped his character, long before the world knew his name. After moving to London as a teenager, he trained at St. Mary's Hospital Medical School, where his early brilliance earned him a place in the laboratory of Sir Rothwright, a pioneer in immunology. Fleming was not known as a flamboyant genius or a dramatic speaker. Instead, he was a careful observer, deeply skeptical of assumptions, and intensely curious about the natural world. His service as a captain in the Royal Army Medical Corps during World War I proved to be a turning point in his thinking, as he witnessed countless soldiers die not from their wounds, but from deadly infections that followed them. These experiences convinced him that antiseptics, widely used at the time, often cause more harm than good by destroying healthy tissue, while failing to reach deep-seated bacteria. After the war, Fleming returned to his laboratory with a growing determination to find a better way to combat infection. In 1922, he made an important but less celebrated discovery when he identified lysozyme, an enzyme present in tears, saliva, and mucus that could break down certain bacteria, demonstrating for the first time that the human body possessed its own natural antibacterial defenses. Though lysozyme was not powerful enough to treat serious infections, it reinforced Fleming's belief that nature itself held solutions to medical problems, waiting to be understood rather than forced. It was in September 1928 that chance and preparation converged in a moment that would change the world forever. Returning to his cluttered laboratory after a holiday, Fleming noticed that one of his petri dishes containing Staphylococcus bacteria had been contaminated by a mold, and that around this mold the bacteria had been destroyed. Where others might have thrown the dish away, Fleming paused, observed, and asked a critical question. Why? He identified the mold as Penicillium notatum and realized it was releasing a substance capable of killing bacteria without harming human cells. Fleming named the substance penicillin and published his findings in 1929, clearly describing its extraordinary antibacterial properties. However, Fleming lacked the chemical expertise and resources to purify and mass-produce penicillin, and for nearly a decade his discovery remained largely overlooked by the scientific community. The true potential of penicillin would only be realized in the late 1930s and early 1940s, when Howard Florey, Ernst Borischain, and their team at Oxford University succeeded in isolating, purifying, and producing penicillin in usable quantities. During World War II, penicillin became a medical miracle, dramatically reducing deaths from infected wounds, pneumonia, and other bacterial diseases that had previously been fatal. Fleming, characteristically modest, repeatedly emphasized that he did not invent penicillin, but merely discovered it, insisting that nature had made penicillin and he had only found it. His humility did not diminish the global recognition he received. In 1945, Fleming shared the Nobel Prize in Physiology or Medicine with Florey and Chain for their combined contributions to the development of penicillin. Beyond his most famous discovery, Fleming also issued a prophetic warning that remained profoundly relevant today. He cautioned that misuse and overuse of antibiotics could lead to resistant bacteria, a prediction that had become one of the greatest challenges of modern medicine. Fleming continued his work at St. Mary's Hospital until his death in 1955, quietly shaping generations of scientists through his example rather than his words. His legacy extends far beyond a single drug. It lies in the demonstration that scientific progress often arises not from grand plans, but from patience, curiosity, and the courage to trust evidence over assumption. Alexander Fleming's life story is not only the tale of discovery that saved millions, but a powerful reminder that even in the smallest, most ordinary moments, the power to change the world may be waiting for those willing to truly observe.
Alexander Fleming was a Scottish doctor and microbiologist who discovered the world's first effective antibiotic, penicillin. This discovery revolutionized medicine and has been described as the single greatest victory ever achieved over disease. It's estimated that well over 200 million people have had their lives saved by penicillin, and it continues to be an effective medicine used all around the world to this day. In this video, we're going to tell the story of Alexander Fleming's life, examine how he discovered penicillin, how it transformed medicine, and how Fleming's discovery ushered in a new age of civilization. And then finally, explore the terrifying possibility of antibiotics, like penicillin, no longer working. This is how Alexander Fleming changed the world. Alexander Fleming was born on the 6th of August, 1881, in East Ayrshire, Scotland. He lived a relatively normal childhood, until the age of 7, when his father sadly passed away. Luckily, his family made it work with his father not being there, and Alexander earned a scholarship to the Kilmarnock Academy, which then later enabled him to move to London, where he attended the Royal Polytechnic Institution in Westminster. From there, Alexander followed the career path of his brother, Tom Fleming, who was a doctor. And in 1903, Alexander enrolled at St Mary's Hospital Medical School in Paddington, London. Whilst at medical school, Alexander joined the Rifle Club and was reportedly a good shot and a vital member of the team. So once Fleming finished his degree and was set to leave the medical school and the Rifle Club, the captain of the Rifle Club, wishing to keep Fleming as a member of the team, suggested he join the research department at St Mary's Hospital. Fleming joined the research department, becoming assistant bacteriologist to Sir Almroth Wright, who was a pioneer in vaccine therapy and immunology. This was a key moment in Fleming's life, and quite frankly, for humanity. Joining this research department set him on a path to discovering penicillin and changing the world. Fleming went on to earn a Bachelor of Science in Bacteriology and become a lecturer at St Mary's Hospital. Alexander Fleming served throughout the First World War in the Royal Army Medical Corps. During his time in the First World War, Alexander and his colleagues from St Mary's Hospital effectively moved the entire inoculation department of St Mary's to the British Military Hospital at Boulogne-sur-Mer in France. Whilst serving, Fleming witnessed the deaths of many soldiers from sepsis. Sepsis is a life-threatening condition where your body overreacts to an infection and starts attacking its own tissues and organs. Fleming observed that the antiseptics which were commonly used to treat infected wounds at the time often didn't work, or even worsened the injuries. In an article he published in 1917 in The Lancet, a medical journal, he explained how antiseptics were actually killing more soldiers than the infections they were trying to treat. Antiseptics worked well on the surface, but deep wounds tended to shelter bacteria from the antiseptic agent. Antiseptics also appeared to remove beneficial substances created by the body to help fight the infection. And once these were removed, the bacteria the antiseptic failed to kill had free rein to infect the body. Alexander Fleming's mentor, Sir Almroth Wright, strongly supported Fleming's findings, but despite this, most physicians working during the First World War continued to use antiseptics to treat infections, even in cases where it worsened the condition of the patient. After the First World War, Alexander Fleming went back to working at St Mary's Hospital, where he investigated antibacterial substances and their effects on animal tissues. It was here, in 1921, that Fleming made one of his first great discoveries, lysozyme. Lysozyme is an antimicrobial enzyme produced by animals, including us humans, that forms part of the innate immune system. Whilst working in his laboratory, he found one of his agar plates had been contaminated. Agar plates are petri dishes that contain a growth medium that is solidified with agar, and agar is a jelly-like substance created from algae. He found one of his agar plates was contaminated with bacteria from the air. For some reason, He then decided to add nasal mucus to the contaminated agar plate, and to his surprise, he found the mucus inhibited the growth of bacteria in the contaminated agar plate. Surrounding the nasal mucus that he had put in the agar plate was a clear, transparent circle which indicated a killing zone of bacteria. Fleming then decided to test nasal mucus on a different type of bacteria that was growing in a yellow saline solution. Within 2 minutes of adding fresh nasal mucus, the yellow saline turned completely clear. Fleming then had the idea to experiment with tears rather than mucus, asking all of his co-workers to contribute. As V.D. Allison, one of Alexander Fleming's research colleagues, recalled, "For the next 5 or 6 weeks, our tears were the source of supply for this extraordinary phenomenon. Many lemons were used after the failure of onions to produce a flow of tears. The demand by us for tears was so great that laboratory attendants were pressed into service, receiving 3p for each contribution." Alexander Fleming went on to not just test mucus and tears, but also sputum, cartilage, blood, semen, ovarian cyst fluid, pus, and egg white, showing that the antimicrobial enzyme lysozyme that inhibited bacterial growth was present in all of these. Fleming reported his new discovery to the Medical Research Club and Royal Society, but no one seemed that interested. His paper describing lysozyme received no questions and no discussion, which was a pretty clear indication that people viewed it as insignificant. Lysozyme had very little therapeutic potential, as the enzyme was only really effective against small amounts of relatively harmless bacteria. But it was still an important discovery that helped to understand how animals' immune systems, including our own, worked. It wasn't until the late 20th century that the importance of Fleming's discovery of lysozyme was recognized. It was actually the first antimicrobial protein ever discovered that made up part of our innate immune system. V.D. Allison, one of Fleming's research colleagues, also recalled that Fleming was not a tidy researcher, and as a result would regularly expect unusual bacterial growths to appear in his culture plates. But this untidiness was not necessarily a bad thing. In fact, it was probably a good thing. V.D. Allison actually attributed Fleming's untidiness to his success in discovering lysozyme and later penicillin. After Fleming's discovery of lysozyme, he continued to study bacteria for many years in his laboratory at St. Mary's Hospital. In September of 1928, Fleming was going on holiday with his family to Suffolk. Before leaving his laboratory, he inoculated Staphylococcus bacteria on culture plates and left them in a corner of his lab. On his return from his holiday, on the 28th of September 1928, Fleming found that one of the culture plates he'd inoculated was contaminated with a fungus, and the Staphylococci bacteria immediately surrounding the fungus had been destroyed. Upon seeing this, Fleming famously remarked, "That's funny." Alexander Fleming identified the mold growing on the culture plate as being from the genus Penicillin. He went on to grow more of this mold, and quickly discovered it contained antibacterial properties. After further investigations, Fleming found it had a pronounced impact upon Staphylococci bacteria and other similar gram-positive pathogens that can cause things like scarlet fever, pneumonia, meningitis, and diphtheria. This accidental discovery would turn out to be one of the most significant medical breakthroughs in human history. Little did Alexander Fleming know at the time, but he had just discovered something that would go on to save hundreds of millions of lives and totally change the world. Fleming initially just called what he had discovered mold juice, but after several months of work, he gave the antibacterial substance present in the mold the name penicillin, which it is still known as today. Alexander Fleming presented his new discovery to the Medical Research Club in 1929, but once again, nobody seemed that interested. The chair of the meeting later reminisced but he didn't sense any importance in Fleming's discovery at the time. Fleming went on to publish his work in the British Journal of Experimental Pathology. Once again, little attention was paid to the article. The difficulty of isolating the main compound of penicillin and producing large amounts of it were one of the main reasons for a lack of interest. If production couldn't be scaled up, penicillin was deemed effectively useless to the medical community. Fleming later received help from Howard Rainstick and his team of biochemists from the London School of Hygiene and Tropical Medicine, but they came to the conclusion that chemical purification of penicillin was futile. They thought it just could not be done. As a result, penicillin was largely forgotten about throughout the 1930s. But Alexander Fleming did not give up. He knew penicillin's potential. Fleming first tried to use penicillin clinically in 1929 on a research scholar named Stuart Craddock, who had developed a severe infection of his nasal cavity. But the penicillin didn't seem to have any effect. Fleming thought this was likely because the infection was caused by a type of bacteria he had already discovered was resistant to penicillin. The first recorded successful use of penicillin was not actually conducted by Alexander Fleming, but by Cecil George Payne, who was a pathologist and former student of Fleming. Payne successfully used penicillin to treat 1 adult and 3 infants of conjunctivitis eye infections in 1930. It wasn't until 1932 that Fleming first successfully treated someone with penicillin. Keith Bernard Rogers, who was a medical student at St Mary's Hospital and captain of the university rifle team at the time, developed a severe conjunctivitis eye infection. Rogers had planned on participating in a rifle shooting competition, but due to his eye infection was going to pull out. However, Fleming applied penicillin ointment to Rogers' eye, curing his conjunctivitis, and it's even reported that Rogers went on to actually win the shooting competition, all thanks to Fleming's penicillin. In 1936, at the Second International Congress of Microbiology, Alexander Fleming gave presentations about penicillin's importance and potential value for the treatment of infections. But once again, no one really listened to him. There was a complete lack of interest or discussion about penicillin. Whilst there, Fleming had the opportunity to read a paper of his work on penicillin at a meeting attended by the most prominent bacteriologists from all over the world. Once again, they failed to see any value in his work. Fleming's core idea was that penicillin could be used to prevent and treat bacterial infections, but many of the bacteriologists there simply did not support this view. As a result, Alexander Fleming was utterly deflated. His fellow bacteriologists from all over the world, people who had dedicated their lives to studying bacteria, just as he had, could not see any value in his work. It must have been so disappointing. This setback did not dissuade him from continuing to work on, investigate and experiment with penicillin though. He was convinced of penicillin's potential value to the world and was determined to make it a reality. Looking back now, it really is staggering how almost no one during the 1930s, besides Alexander Fleming, saw the potential of penicillin. Without Fleming's perseverance, penicillin may never have become a widely available drug. Alexander's conviction and determination was a real gift to humanity. The millions upon millions of people who have had their lives saved by penicillin owe a great debt to Fleming. In 1939, Fleming's perseverance paid off. Ernst Chain, a biochemist, joined the School of Pathology at the University of Oxford to investigate antibiotics. Whilst there, Ernst Chain happened to randomly come across one of Alexander Fleming's papers from 1929 on penicillin. Ernst instantly saw penicillin's potential, and after reading the paper, he went straight to his supervisor, a gentleman by the name of Howard Flowery. Howard Flowery was an Australian pharmacologist and pathologist working at Oxford who had just received a $25,000 research grant, which was a lot of money back then, from the Rockefeller Foundation to study antibiotics. And so, Howard Flowery and Ernst Chain assembled a team of researchers at Oxford to begin work on the isolation and purification of penicillin. Fleming's tireless work had finally paid off. Ernst Chain and Howard Flowery not only saw the potential of penicillin, but wanted to do everything they could to make it a reality. The team at Oxford worked to produce a concentrated extract of penicillin that could be used in a powdered form. And in May 1939, they conducted their first study of penicillin, injecting 8 mice with a virulent strain of bacteria, then injecting 4 of those mice with penicillin extract. After just 1 day, the 4 mice that didn't receive any penicillin were dead. But the 4 that did receive penicillin survived. Ernst Chain remarked upon seeing the result, "It's a miracle." The team published their findings in The Lancet in 1940. Shortly after publication, Alexander Fleming telephoned Howard Florey to say that he would be visiting the team at Oxford within the next few days. When Florey told the team Fleming was coming to visit, Ernst Chain remarked, "Good God, I thought he was dead." In 1941, the Oxford team attempted to treat their first human patient with penicillin. Albert Alexander, a police officer, had a severe face infection. Upon receiving penicillin, his condition did start to improve. However, at this time there was only a limited supply, so they actually ran out of penicillin before they could finish treating him, and sadly, he passed away. Not a great start for the Oxford team, but it did teach them a valuable lesson. For penicillin to be effective in treating severe infections, it needed to be given in much larger quantities. A year later, in 1942, Alexander Fleming carried out an important clinical trial for penicillin. Harry Lambert, who was a colleague of Alexander Fleming's brother, was suffering from a potentially fatal infection of his nervous system. Fleming asked the team at Oxford for a purified sample of penicillin, which he then used to inject into Harry Lambert's spinal canal. Within just a day, Lambert started showing signs of improvement, and within a week, he had recovered. Fleming reported this clinical trial in The Lancet in 1943, and this evidence would later prove vital in helping to convince governments to mass-produce penicillin. I think it's important to stop for a second and realize just how monumental this moment was for humanity. Before penicillin, contracting a bacterial infection had the potential to be life-threatening. At that time, 90% of children with bacterial meningitis died. Common problems like strep throat and ear infections could spread throughout the body and cause serious medical issues. But Alexander Fleming's discovery of penicillin changed all of that. For the first time in human history, we had a powerful and effective medicine to fight bacterial infections. It opened the door to the mass rollout of antibiotics and completely changed our world. During the early 1940s, whilst these developments of penicillin were occurring, the Second World War was raging. As with all previous wars, infected wounds were a huge problem. A mild cut or injury acquired on the battlefield had the potential to become infected and turn into a life-threatening issue. Penicillin offered a solution to this problem, and it would be a real advantage in the war to have an effective antibiotic to treat your troops. The only issue was how to scale up production of penicillin. Initially, in 1941, the team at Oxford tried to convince the British government to mass-produce penicillin. But at that time, they just couldn't persuade them. The British government was in the midst of war and likely didn't have the resources to spare on such an unproven and risky project. So, Howard Florey and other members of the Oxford team travelled to the United States of America to persuade the American government and pharmaceutical companies to help mass-produce penicillin. They met with a number of government and pharmaceutical officials who immediately saw the potential of penicillin. Work quickly began at a USDA laboratory in Peoria, Illinois, and by the end of the first month, they were making their own culture of penicillin. However, they realized Alexander Fleming's original mold sample that all previous cultures had been grown from was not efficient enough to produce large quantities of penicillin. So, with the help of the US Army Transport Command, a great search began to find similar, but more efficient mould samples from all around the world. They brought back samples from China, India, South Africa, but the single best sample was actually from a cantaloupe melon purchased in a fruit market in Illinois near the laboratory. Between 1941 and 1943, researchers in America focused on industrializing penicillin production and isolating higher-yielding strains of penicillin. Simultaneously, researchers working for Pfizer, a pharmaceutical company, developed a practical deep tank fermentation method that would enable large quantities of pharmaceutical-grade penicillin to be produced. At this point, penicillin had proven to be effective, and there were realistic methods for mass production. So the British Ministry of Health were contacted and convinced of the importance of penicillin. The British War Cabinet was convened and also convinced of penicillin's potential. And as a result, the Penicillin Committee was formed in April of 1943. On the committee was Alexander Fleming, Howard Florey, and representatives from the pharmaceutical industry. The main goal of the committee was to facilitate the production of large quantities of penicillin as fast as possible, and they planned to do this in collaboration with American pharmaceutical companies, who were realistically the only people at the time capable of ramping up production. The Penicillin Committee aimed to exclusively supply Allied armed forces with the drug in an effort to help win the Second World War. And by June 6, 1944, otherwise known as D-Day, enough penicillin had been produced to treat all the wounded troops of Allied forces. And so, the world's first effective antibiotic, penicillin, became available to fight bacterial infections. A huge victory for humanity and modern medicine. And it didn't take long for penicillin to become available to the public. Here's an advert from 1944 that reads, "Penicillin cures gonorrhea in 4 hours. See your doctor today." After the Second World War had ended, penicillin was rolled out on a massive scale and immediately began saving lives. Doctors who had previously had few options in the fight against bacterial infections now had a powerful medicine. Truly a momentous moment for humanity and modern medicine. Fleming's discovery and the hard work of the people at Oxford and in the United States had changed the world. Alexander Fleming's discovery of penicillin earned him a long list of prestigious awards and titles. In 1943, he was elected a Fellow of the Royal Society. In 1944, he was knighted, becoming Sir Alexander Fleming. He was awarded the Medal of Merit by the President of the United States, was made a Grand Cross of the Legion of Honor by the French Republic, and was made Grand Cross of the Order of the Phoenix of Greece. And in 1945, Alexander Fleming, along with Howard Florey and Ernst Chain, shared the Nobel Prize in Physiology or Medicine for the discovery of penicillin and its curative effects. Alexander Fleming and the members of the Oxford team did not patent penicillin, as they thought doing so would be unethical. However, that didn't stop American pharmaceutical researchers from patenting the production of penicillin. And when Alexander Fleming discovered what they had done, he said, "I found penicillin and have given it free for the benefit of humanity. Why should it become a profit-making monopoly of manufacturers in another country?" It's easy to understand Fleming's frustration. He'd worked so hard, discovering penicillin not to make money, but to help humanity. And here were individuals in America trying to get rich from the hard work of Alexander Fleming and the team at Oxford. On the 11th of March, 1955, aged 73, Alexander Fleming died at his home in London of a heart attack. His ashes are buried in the crypt of St. Paul's Cathedral in London. But his death isn't the end of this story. Fleming's discovery of penicillin ushered in a new age of medicine. There are now over 100 different types of antibiotics available to help treat minor and life-threatening bacterial infections. Hundreds of millions of people have had their lives saved by penicillin, and it has been estimated that antibiotics have increased average life expectancy in the developed world by as much as 20 years. Today, antibiotics have become so widespread and easily available, even in the developing world, that it's hard to imagine life without them. They are crucial to so many aspects of modern healthcare. Every year, millions of operations are carried out, and antibiotics are used to prevent pre- and post-operative infections. 1 in 4 births are by caesarean, and antibiotics are used to protect both mother and child from infection. 50% of all women will suffer a urinary tract infection at some point in their life, and most of them will need antibiotics to treat the infection. Cancer treatments can suppress the body's immune system, so antibiotics are needed to help keep people alive whilst they receive their cancer care. And I could list 100 other examples of how antibiotics are now vital to modern healthcare. But here's the scary thing. We may soon be facing a reality where antibiotics no longer work. This is because of the rise of antibiotic resistance. Antibiotic resistance is a consequence of evolution via natural selection. Bacteria that cause infections would naturally develop resistance over time, but when antibiotics are used, it creates an environmental pressure on the bacteria, wiping out bacteria that are susceptible to antibiotics, but leaving the few bacteria that have a resistant mutation alive. These mutant bacteria live on to reproduce, passing their resistant mutation onto their offspring, which in turn creates a resistant generation of bacteria. Already today, antibiotic-resistant infections are a leading cause of death around the world, particularly in developing countries. It's estimated that in 2019, 1.3 million deaths directly resulted from illnesses caused by drug-resistant bugs. Antibiotic resistance is not a new phenomenon. Alexander Fleming discovered early in his research that bacteria developed antibiotic resistance whenever too little penicillin was used, or when it was used for too short a period of time. In many of his speeches, he cautioned doctors to not use penicillin unless there was a proper diagnosis for it to be used. He's also quoted saying that, "The time may come when penicillin can be bought by anyone in the shops. Then there is the danger that the ignorant man may easily underdose himself by exposing his microbes to non-lethal quantities of the drug, making them resistant." Sadly, we did not heed Alexander Fleming's advice, and today we face the very real threat of antibiotic resistance that he warned us about. If we fail to stop antibiotic resistance, it could render most, if not all of our antibiotics useless. Without effective antibiotics, modern medicine would grind to a halt, and our lives would become immeasurably worse. The United Nations estimates that by 2050, antibiotic resistance could kill up to 10 million people a year. So, what can we do to fight antibiotic resistance? A good place to start would be to tackle overprescription. Over 30% of antibiotics are given out unnecessarily in America, and that figure can rise up to 50% in developing countries like India. There is a common misconception that antibiotics can treat any infection. That's just not true. If you take antibiotics when you have a viral infection like a cold, flu, or COVID-19, it will do nothing to help you. Antibiotics only work against bacterial infections. The more we use antibiotics, the more likely resistance is to develop. So by wasting them on people who don't need them, we're only making the situation worse. Another major contributor to antibiotic resistance is animal agriculture and animal farming. Our consumption of meat, dairy, and eggs plays a major role in this crisis. It's estimated that 80% of all antibiotics sold in America are used for animal farming. Antibiotics are routinely given to animals to make them grow faster and to prevent disease, rather than to treat infections like they should be used. This then lets farmers pack more animals into awful, unhygienic and cramped conditions, which creates the perfect breeding ground for antibiotic resistance to flourish. We're already seeing antibiotic-resistant strains of Salmonella and Campylobacter that have originated from animal agriculture. If farmers are not stopped from using antibiotics like this, we will have no chance of stopping antibiotic resistance. Developing new antibiotics will also be vital in fighting antibiotic resistance. All those years ago, in 1929, Alexander Fleming effectively discovered penicillin through trial and error. But today, discovering and developing new antibiotics is exceptionally difficult. In most countries, the price of antibiotics is kept low by governments in order to make sure such vital medicine is easily available to the public. But this means pharmaceutical companies have little incentive to develop new antibiotics, as they make almost no profit from them. It's also expensive and arduous to bring a new drug to the market, typically taking 10 years or more and costing around $1 billion. As a result, pharmaceutical companies simply don't develop new antibiotics anymore. The most recent discovery of a new antibiotic class that made it to market was in 1987. Since then, there has been very little investment and innovation in the antibiotic field. On a positive note though, in the last few years, innovation and research around antibiotics has slowly begun to ramp up again. We're nowhere near where we need to be, but progress is slowly being made in the right direction. So, to conclude, Alexander Fleming discovered penicillin, giving humanity a powerful and world-changing medicine. Without Fleming's hard work and perseverance, we may never have developed penicillin. As a direct result of his discovery, hundreds of millions of people have had their lives saved. There are very few people throughout history who can claim to have been involved in saving so many people. That alone should grant him a place in human history. It's rare you come across someone who was so dedicated to using their knowledge and expertise for the benefit of humanity. Alexander Fleming devoted his life to penicillin, not for fame, glory or wealth, but for the good of humanity. Our world needs more people like him, and without a doubt, Alexander Fleming changed the world.